Talks at the Labour Court aimed at resolving the pay and conditions dispute at the National Ambulance Service will resume this morning. SIPTU has described the discussions as difficult and said agreement has not yet been reached. The Labour Court has asked the parties to return today as a final opportunity to try to resolve the dispute before next week's industrial action, which would involve a 72-hour work stoppage amid an ongoing work to rule. The dispute over pay and conditions stems from accusations that the HSE has failed to implement the pay scale recommendations of an independent report from 2020. For their part, paramedics, emergency medical technicians and ambulance staff claim the scope and duties of their roles has expanded in recent times, but the pay has not matched this change. Joining me for the latest on this is Clooney Quinn-based Midwest Irish Ambulance Representative Council member Orla Considine. Orla, you're very welcome to the programme this morning.
Good morning there, Dara.
Orla, it's always a pleasure to have you on. I'm sure today you'd rather be coming to us about the handball results again, but we have to ask you, where are we at in the ambulance dispute back at the Labour Court today?
Hard to say. Like, we know that we have been there for Monday and Tuesday of this week, full time, but the talks were suspended yesterday at the judge's request and restart this morning. So everybody entered in without an agreement that they would go without preconditions, and I suppose getting some of those preconditions off the table has been proving difficult. So the talks have not really progressed any further along, but everybody is still willing to sit around that table, and they will start again today for what probably be another long day.
It's been just over a week since ambulance workers held the 24-hour work stoppage, and everybody can recognise the importance and how essential the ambulance service is. For those of us that aren't used to trade union talks, we'll be wondering why something like this is taking so long for such an important service. Could you maybe talk us through the jigs and the reels and what goes on in these meetings and why these things are so protracted?
Well, I suppose the answer to that is really not yet. But as I suppose the union side would put it, when representing the workers, there's been a vote twice on this proposal already, which has been rejected by the workers, and that is seen as that the positions that were put forward by the management of the ambulance service and the HSE, while they were offering some pay rise, they were also taking away conditions in relation to shift pay and some allowances that members would have for training that they would have done many years ago when the service started. And that service has developed so much, but there's still a shortage of up to 2,000 staff to meet current demands in the ambulance service that's going year on year. So they don't have the staff to fill positions, and with that then they want to change in overtime rates, but the service can't survive at the minute without that. So there's a lot of preconditions there to changes in terms of service and then rosters and working conditions that are already difficult enough for staff. So they want those services recognised and protecting the job for people who will be coming into the job afterwards, because we need to entice people into the job and then we need to retain them in the job, and that's not currently happening at the minute.
So you're saying that because of that staff shortage, you're doing more duties than you should be doing, essentially your role has expanded? Not that it has expanded in that way, but people are definitely spending more time in work than they would. The job has also expanded in the range of medications, the number of conditions and the amount of treatments that people are able to do for somebody in their house or at the roadside. So some of it is done in hospitals by doctors who have plenty of support around them, and that's not available when you have a 2 or 3 person crew in an ambulance at the side of a road or in a person's house. So the medical ability of the people who are working in the service and their skill level has grown exponentially over the last 20 years. And I suppose that's not recognised insofar as currently the medical staff that work for the ambulance service are classed as support staff by the HSE. They are not classed or paid as medical staff. And that's a worry for the people who work in service. So that's a worry for pay. And in terms of the independent recommendations from this pay scale review in 2020 that the unions representing you and ambulance staff say hasn't been implemented by the HSE. What's missing there that you're looking for?
To move into the medical staff would be one of that, and then I suppose to put the pay on par with those who are trained, educated, research-based medical professions. Everybody now going into the ambulance service to become a paramedic, to move on to some of the advanced or specialists, must have a level 8 degree. That has changed over the years, no more than nursing and medical services. So it's important that that change in education and research-based decision-making is recognised as well too. So the report that was published, which is 6 years ago, which took 6 years in the making, is really actually 12 years going on. And several discussions have been had about it and trying to get an implementation for it. And yes, there was 2 votes and proposals, but they didn't recognise the medical development of the people working in the service, and they were looking to change the financial terms and conditions. So it's to recognition for that upskilling and development that people have taken and how they have progressed the service.
Outside of the planned work stoppages, the HSE claims the ongoing work to rule is having a significant impact on ambulance services. Would you agree with that, Orla? And what if any services are actually affected at the moment?
It probably is, and I suppose people working in the service would be saying hopefully it is, because it would point out to some of the inadequacies or the lack of staff that we have in the service. So 4 years ago, the service stopped implementing where there was appoint supervisors for the staff. And those supervisors would be people in bases who would fill drug bags, who would order stock, who would look after rosters, who would look after sick leave, leaves for application. So those supervisors, who should be in a ratio of 1 to 5 of staff, have stopped being appointed by the ambulance service management. So there's a shortage in people to do those jobs. So as a result, some people who work on frontline positions as paramedics or advanced paramedics have been helping out and stepping up doing those jobs free of a cost to the service. So they're no longer doing that. So nobody's working above their rostered and contracted position. Some of the staff would also have gone and done training to be able to provide manual handling or MAPA courses, and they're no longer tutoring those coming off the road from their frontline position to do that. So the people who are working on the frontline are just doing their frontline duties, and they're not doing, I suppose, things that are needed in assisting the management side of the service.
And if we don't get a breakthrough today, Unite and SIPTU, the unions representing ambulance workers, say that a 72-hour work stoppage will take place from next week. Understandably, the public will have concerns over that. Will there be a contingency plan in place for emergency calls?
Yes, the public and the people who work in the service would have concerns about that. There will be some contingency arrangements. There always will be. Those are not decided yet because people are hoping that the stoppage will not go ahead. This week's stoppage was called off at the request of the Labour Court so that talks could be progressed. They haven't asked for that to be considered for next week. So it's still planned that the stoppage will go ahead, but there's been no, other than people, than the staff being aware that that might happen, that hasn't progressed in definite planning yet, but there will always be contingency for the most serious of calls out there.
So talks have been ongoing for well over a week now. Are you hopeful that there will be, or even confident that there will be a breakthrough?
Well, you have to be hopeful because we wouldn't enter into talks without it. There was a day of talks last week as to see whether it would be worth agreeing into talks if people could be brought together. The fact that those talks actually started has to be an indication that there must be an ability someplace along the line. And I suppose it's finding that point, because nobody would have entered into it if they didn't hope that that would happen.
And naturally, look, from your point of view, I know obviously ambulance workers feel that they have to take a stand, but do you feel, I suppose, any nervousness about how long that this might continue and how it could potentially impact people if it has to go on?
Absolutely, and a huge responsibility as well too. And nobody can doubt that, because we know I suppose only we know, and the people in their greatest need know what we meet on a daily basis when we go to work. And you never know what's ahead of you when you go in. And I suppose that it's not just by day, it's also by night and in the darkness and in the low hours of the morning. And nobody knows, and whether it's people in need in their house or unsafe situations, nobody knows what they're facing ahead of. And I suppose that's what needs to be recognised. So there's always a fear from our side that, something could go wrong and we're not available to help out in that. And it's definitely not what's wanted. I suppose the question we turn back is, when we ask the HSE and the ambulance service management and I suppose the Department of Health, how do we get listened to if you haven't been listened to properly for definitely the last 6, but probably ongoing 12 years? So I suppose all other avenues have been exhausted, and the only reason we are sitting properly around the table is because of the action that was taken last week and the support that was given from the public, because the public know when they want, what they kept saying last week was, when we need somebody, there's somebody comes. And we know in West Clare and North Clare and all parts of Clare, there's been huge delays at times for ambulances. So we need that service to progress and to develop, and we can't if we can't keep people into it.
Well, we'll certainly hope that there is a breakthrough achieved sooner rather than later. Orla Constantine, Clooney Quinn-based Midwest Irish Ambulance Council representative. Orla, thank you very much for joining us on the programme today.
Thanks, Dara.